I've said this on the first day pa lang, no? That the budget that we're talking about, the 300 billion here, only 10 or 11 billion is for capital outlay. The entire capital outlay of the national government next year is 1.1 trillion. And we're only spending a microscopic 1% on capital outlay. And we know we've underinvested in health. And most of the countries around the world are doubling their health budget, preparing also for the next pandemic, increasing hospital beds, improving their hospitals and equipment. And we are not doing so. No, so it's so
Mr.
unfortunate.
President, I have expressed the same sentiment
Yes.
in earlier interpellations because I had wanted to be able to sponsor a
Yes.
DOH health budget that was
Yeah.
something that I
I
could
can tell
really,
you where we can get the money also for that. As I presented the other day, I think during the budget of the Department of Transportation, the Department of Transportation budget, NEP submitted 145 billion, has been cut by the House, by the Senate, because we know that they cannot spend it. It's now down to something like 110. But yet, over the last 5 years, they could not spend more than 25 billion in a year. The problem is, will the Department of Health know what to do with it, assuming we give them the money for the infra? Baka masayang lang din naman kung wala silang plano. Diba? What to do
meron
with
naman, Mr. President, meron naman, kaya lang na-slash din yung budget nila because of low utilization. So,
Yeah, correct.
personally, I would like
Utilization.
to put
Yeah,
more
yeah.
funding in health infrastructure.
Correct, correct. Low utilization ng DOTR. Kung high utilization na yan, pwede ilipat sana doon. Ang problema, baka low din at idaan din sa PITC. Yun ang nangyari doon sa mga rural health unit nila eh. Yung gamit din, pinadaan sa PITC, hindi rin na-deliver. And then of course, adequate planning with the local governments. No? And you know, Senator Lacson was correct kanina to ask, no? How many hospital beds do we have? And you replied 109, 110,000. That's correct. It's roughly 1:1. 1,000 to 1 bed to 1,000. No? But then, if you take a look at that, 30% of that is in Metro Manila. More than 30,000 is in Metro Manila. Divided between the public and the private. I do have that here. I have public and private, all the regions. Would the DOH know, government, how many hospital beds are there in NCR? Government hospital beds, how many in NCR? Total country, how many in NCR? How many in Calabar Zone? Would they have that number? Government Philippines, 49,938. NCR, 17,486. Region 4, 3,362, and Region 4 is much bigger than NCR. Okay? If you go to the private...
Yes, Mr. President. NCR is really by far the highest, followed by Calabar Zone,
Yes.
Region 4A, and then
Diferensya.
Region 3, Central Luzon.
Correct. Ang layo
The
ng...
rest are much lower.
Correct. So ito dapat ang pinaplano, yung health infrastructure natin. And then, just to wrap up, no? Okay. I've always asked, no? Yung sa PhilHealth, why is it that 60% or what percent today of PhilHealth, yung packages nila, how much goes to public and how much goes to the private sector?
Mr. President, 60% goes to the private, and 40% goes to the public.
Correct. And that's why hirap na hirap tayo to improve our public hospitals din.
Yes, Your Honor is
And,
correct.
When we were running 12 hospitals in the province of Batangas when my wife was governor, okay, ang hirap kumolekta sa PhilHealth. Pero pag pribadong kumolekta, mabilis. Diba?
Let me get a response on that. Anong response niyo?
May advance pa pagka pribado, pagka publiko, wala. Kaya nagkalintik-lintik na yung PhilHealth eh.
Well, the response, Mr. President, is pareho lang daw.
What is pareho lang? Isn't it 60-40?
No. Pareho lang daw yung the time it takes to reimburse the
That is not true.
whether public or
And
private.
remember, it is not only the time. We're talking about the value here. It's 60-40.
Yes, Mr. President, that one is confirmed. Sa kanila galing yan,
Correct.
na
We have
60-40.
the, yes, correct. Okay. So, and, if we want our public hospitals to get better, let's make the investments there as well so that they can get a bigger slice also of the PhilHealth, di ba?